this one, and this one. These are all the major tourist places which was abandoned just because of COVID-19 crisis. And we all know the social dilemma that was going on, economic crisis all across the globe, and all these scenarios. And this is a true picture of depicting COVID-19's introduction, which is a deadly virus. So, and another problem that was with the COVID-19 crisis was every department from CDC, European Union, along with that, World Health Organization, everyone was giving their own clinical recommendations, and there was no guidelines available for the doctors. And this is not what I'm talking about on this particular day. The study was done back in March 2020, which was the very beginning of this pandemic. So we came up with the problem that how can we respond to this deadly situation? What can we do really about it? So we thought about it and we figured out the best way to cope up with the COVID-19 management should have 4 points. One is it should have antiviral. One drug needs to be with the antiviral properties. And by antiviral properties I mean an antiviral that can kill SARS-CoV-2. And then comes the second thing, the second drug, that is antibacterial properties or antimicrobial properties. And that antibacterial, antimicrobial properties should provide us with the defense against superadded infections, right? So 2 drugs. And the third drug in the treatment regimen should be immunomodulatory products, which enhances our immunity. And the fourth drug that was being used in the COVID-19 management was anti-inflammatory drugs. Like you must have heard the names of dexamethasone. That is basically provides us with the anti-inflammatory properties. And the fourth thing that needs to be there is that all the 4 drugs need to be cost effective and readily available all across the globe. And we figured out, after pondering a lot, and to be honest, with the help of Quran and Hadith, that we have blessed with the 2 products, that is honey and Nigella stevia, which not only has antiviral properties, antibacterial properties individually, but it has antiviral, antibacterial, anti-immunomodulatory, or immunoboosting and inflammatory properties as well. So all the 5 features was in one product, individually, honey as well as Nigella stevia. And this is not what I am saying from this point. This is what the studies have been done for the past so many years. So we figured out that these drugs should be used. So let's move on towards the honey. Honey, as we all know, with the literature research, we concluded that it would decrease the severity of COVID-19 by its antimicrobial properties, immunomodulatory properties, autophagy, antidiabetic, immunomodulatory, and antioxidative properties. So, as far as Nigella stevia is concerned, now even this point, the people are coming up with the literature reviews who is basically adding on information in all these departments. How basically it is decreasing the severity. It increases the immune response, activation of autophagy, inflammation or reduction in reduction of inflammation, oxidative stress, and comorbidities. So all these things. But the main thing is it has all the 5 components. And these in silico and in vitro studies have been done for both honey and Nigella stevia. So the study objective was very clear. It was to measure the efficacy of honey and Nigella stevia as a combination against the treatment of moderate to severe patients. In the moderate patients, we have patients who are febrile and having moderate features of COVID-19. However, in the severe cases, we have patients who are requiring oxygen dependency, who are having oxygen dependence, requiring oxygen, and who are hospitalized. So we designed a study. We made a study design that was randomized, multi-center, placebo-controlled design to demonstrate its efficacy. And the period of study was defined to be 3 months. Inclusion criteria was SARS-CoV-2, RT-PCR positive. Along with that, moderate to severe disease. No asymptomatic or patients with mild disease were enrolled in the study. As far as exclusion criteria is concerned, in the exclusion criteria, we have excluded all the patients with chronic illnesses, apart from 2, which is diabetes mellitus and hypertension. Along with that, multi-organ failure and ventilatory patients on a ventilator spot were also included. So these are the study sites that we included. Service Institute of Medical Sciences, Shaikh Zayed Medical Hospital, Doctors Township, Ali Clinic. Interventional drugs. Interventional drugs were honey and Nigella stevia. Honey and Nigella stevia was purified and validated by Government College University. And honey was given as 1 gram per kg per day, and Nigella stevia was given 80 mg per kg per day. So the IF approval was taken by Shaikh Zayed, by Service Institute of Medical Sciences, Government College University, and then the registration of the clinical trial was done on clinicaltrials.gov. Outcomes. The basic outcomes that we may have were time taken for the alleviation of symptoms, time taken for the viral load clearance, and a 30-day mortality. These were the primary outcomes. And we have a lot more secondary and additional outcomes as well. So, the randomization was done, 2,523 patients were enrolled and screened, it was screened. And then 313 patients out of those 2,523 met the inclusion criteria. And among those 313 patients, 210 belonged to the patients to the moderate category, and 103 patients were having severe disease. And 210 and 103 was randomly assigned to control and Nigella stevia group. I want to mention one thing over here, that the patient in the control group and the HNS group were having exactly the same treatment. If one patient is having antipyretic, analgesics, anti-inflammatory, antibiotics, whatever they are taking, they were balanced out based on the randomization that both the arms have the same data. Both the arms were having same drugs, apart from one thing, that was just the addition of HNS, honey and Nigella stevia, and the p-value was at the baseline was non-significant for all the drugs and all the treatment. These are the team of investigators that helped us in the conduction of this study in Shaikh Zayed Hospital. This is the lead team investigators in the Service Institute of Medical Sciences. Then let's have a look at the results. So we have two arms. One is the control group, which is basically the placebo arm, and the placebo was given, which was empty capsule with sucrose water. And the other arm was patients who were taking honey and Nigella stevia. And the results were amazing as more than our expectations. It showed 50% reduction in the time taken for alleviation of symptoms. 50% reduction in the time taken for the alleviation of symptoms. Patients in the moderate group were having 4 versus 7. 4 in the HNS group and 7 were in the control group. And this for moderate. And for the severe patients, we have 6 versus 13. 6 for HNS group and 13 for control group. 13 days people with a severe disease took around 13 days to get fully recovered. However, on the other hand, 6 days required by the HNS group for full recovery. 4 days earlier viral clearance, along with that 6 days of normal time taken for the mean oxygen with a 4.7-fold higher of mortality. So, primary outcomes. We can look at the primary outcome, that is 7 versus 4, 13 versus 6, 10 versus 6 and 12 versus 8. And mortality difference is also there. If you look at this graph, this shows that the saturation curve is statistically and even visually different. We can see that the HNS group and the control group has a difference in the earlier achievement of normal saturation. If we have a look at this graph, we can clearly see that 60% of the patients with a cumulative incidence of alleviation of symptoms, we can see that the 4th day it was earlier cleared as compared to the control group. Same goes with the severe patients. On the 63.6 patients of HNS group resumed normal activity. Along with that, 10.9% in the control group resumed normal activities. With the severe patients, 50% of HNS group participants were discharged from hospital, while 2.8% in the control group. And no HNS related side effects were seen. So let's talk about its added advantages. Added advantages was, since HNS has anti-diabetic, anti-hypertensive, cardioprotective, bronchodilator activities. So it would be beneficial for all these things, that it would lower the mortality in all these patients. Along with that, it has anti-platelet and anticoagulant properties. The problem with the COVID-19 was the thromboembolic phenomena. And these thromboembolic phenomena were decreased in these patients as well because of this property. Hepatoprotective and henoprotective effects, antipyretic, analgesic and depressive effects, and antimicrobial properties with the synergism with other drugs. And this study was acknowledged by multiple universities, by multiple journals in the world. That is News Medical Life Sciences, India Daily Mail, Friday Times Pakistan, Business Line, New Drug Ingredients, the French Daily, then the Dr. Mubin Sayyed, who used to conduct discussion on COVID-19. And there are more than 5 lakh views right now on the YouTube that Dr. Mubin who discussed our study. Then comes the citation. 37 citations of this journal have been done in the peer-reviewed journals, in a higher impact factor journals. Then comes the article is published in Chest Journal with an impact factor of 10.78. Conclusion: it promotes viral clearance, quicker recovery, reduces mortality, and over-the-counter drugs availability, and can be used in the management of further advantages. Thank you so much.
Effective is that if you give thymoquine alone, we will need more dose of thymoquine on its own. If you give it in a combination that is made by the nature, with the combination of flavonoids, zinc, quercetin, linoleic acid, it will decrease the required dose and increases the efficacy and provide us with the synergistic effects. The reason that the people are coming towards Nigella stevia and honey is because it does not stop virus at one point, like a conventional drugs. Remdesivir, we have remdesivir, there are so many lepinovir and so on and so forth. Hydroxychloroquine is basically obsolete.
That's all.
Yeah.
Well done, Shabash.